Hello and welcome. I'm Granville Angel, your entrepreneur, natural health consultant, and your guide to holistic living. On this channel, we'll dive into understanding the human body, natural healing, and how you can take charge of your health and longevity. If you care about living well and staying well, you are in the right place. Let's get started. A major cardiovascular health concern is the factor of brain tissue blood supply status. Brain tissue blood supply status mainly depends on the brain artery or the neck artery controlling the brain. Cerebrovascular diseases can be divided into two categories according to their nature. One is the ischemic cerebrovascular disease and the other is the hemorrhagic cerebrovascular disease. For the ischemic cerebrovascular disease, there are many cases concerning the ischemic cerebrovascular disease in clinics. The patients that account for this kind of conditions ranges from 70 to 80% of all patients in cerebrovascular disease. Due to cerebrovascular arteriosclerosis and other reasons, the vessel cavity of brain artery is narrowed and the blood flow is reduced or completely blocked. The brain blood circulation is distorted and the brain tissue is damaged. So a series of symptoms may occur. In hemorrhagic cerebrovascular disease, however, the main cause is usually long-term high blood pressure, congenital cerebrovascular malfunction, and other factors due to the blood vessels rupturing, blood spilling, oppressions on brain tissues, and blocked blood circulation. The patients often show increased intracranial pressure distortion and other symptoms. Therefore, patients account for 20 to 30% of all cardiovascular diseases falls in between these ranges. Now, in clinical diagnosis, if the brain tissue blood supply factor reading is high, this usually indicates the blood pressure is too high, which can lead to a high risk of stroke or aneurysm. If the brain tissue blood supply status factor reading is, however, low, this indicates not enough oxygen and nutrients are getting to the brain, which can result in brain cells death, and stroke is inevitable. Symptoms may include migraine, headache, impatient irritability, and insomnia. In general, cerebrovascular diseases are usually diagnosed in time if patients can pay attention to their health and monitor their symptoms. These symptoms, if detected early, can help in preventing rather than to treat these conditions. But however, in a case of a patient that has been on BP medications for more than 2 to 5 years, regular clinical diagnosis is usually recommended. So therefore, patients are advised to please check with their doctors or their local health professionals to enable them have a proper and quick checks. Then preventive treatment can be administered rather than waiting for a disease state. Sincerely, thank you for watching. If you found this helpful, don't forget to like, share, and subscribe for more health insights and natural wellness tips. Remember, healing the world starts with one person at a time. Stay connected, stay informed, and I'll see you in the next video.